Hi, my name is Jimmy Guzman, and today I'm going to be going over the use of an AED in an emergency situation. So, what things should we cover?
What signs would alert you to need an AED?
So, an AED, you would need it in the situation of what we call sudden cardiac arrest. Uh, Basically, a form of sudden cardiac arrest is an arrhythmia when the ventricles of the heart don't pump correctly or normally, or they completely stop. That can be sudden cardiac arrest. In that situation, we would use an AED to give an electrical shock through the heart and try to defibrillate it in the first place.
What are the precautions for use of an AED?
Precautions when using an AED, there are several precautions that you want to be aware of. Um, First, if you go to put the electric pads on a patient, a few things you want to look for is if they have hairy chest or any hair across the front of the body. You want to shave that with your kit that comes with the AED and clear as much of it as you can to get the best electrode placement. You want to look for if they're covered in water for any reason, such as a swimmer, and you're delivering an electric shock, you want to dry that as much as possible. So you should have a towel with you and be able to dry that off. Of course, your big ones, such as if they have a pacemaker already implanted, we will advise not using the AED. And then if it's an infant, you don't want to use a large AED on an infant. There are AEDs with smaller pads meant specifically for their body type. And yeah, so those are the precautions.
What do you see or observe while performing the technique?
Okay, so this is where I'll explain how to use and what we see when we use an AED. So what we got here is one of our basic AEDs from the training room in Myers building. Most of them come exactly the same. You're going to have your large box here, and it comes with a side bag with your equipment such as razor for shaving the chest. You should have instructions, gauze pads, anything you might need, a biohazard bag for blood, a mask, anything like that, scissors to cut clothing. Also, one of the other precautions you might need scissors for is if a female athlete or somebody has an underwire bra, you'll need to cut that because you're sending an electrical stimulation and you don't want any interference. So basically, when we use an AED, first rule is you want to call 911 every time. So you want to get someone there on the scene as fast as possible. Once you or somebody else around the scene has called 911, you want to open your AED next to your patient. You want to clear everyone away because you're giving an electrical shock. You don't want any interference. Every AED comes with picture and instructions for you to follow, and every AED also gives verbal cues on what to do step by step. So it's very easy. Anybody can use it. So basically, what you're going to do, first thing, you turn it on. Okay. And you can hear.
Apply pads to patient's bare chest.
So it tells you exactly what to do.
Plug in pads connector next to flashing light.
So you'll take your electrode pads, you'll plug them in, they have wires. You plug them directly into the AED and it tells you where to place them. Okay? So you want to place the AED patches on two separate spots. So the first spot is going to be directly on the upper right chest, and the second spot is going to be on the lower left part of the chest above the ribs. The whole idea behind it is that you want to send an electrical stimulation directly through the heart, and that would be the best placement for it. Once those pads are placed and you're clear and you've gone through your precautions, you want to step back, listen to the AED's instructions. What it will tell you next is to step away from the patient, and the AED will actually run a diagnostic check on the person's heart and see if they need an electrical shock in the first place, or if you need to perform CPR. All of this the AED will tell you. So once it's ready to deliver its shock, it'll tell you to stand back, you'll clear the area, and it will deliver its shock. Okay? Once it's done that, you can return to the patient and check their vital signs and make sure everything has gone correctly. In the meantime, you have 911, you have ambulance on the way, and hopefully following these instructions will save a life. Thank you.